Hi all, welcome to EJV's online education program. It's about nurses who are preparing for the exams to the Gulf countries like Oman, Saudi, Bahrain, Kuwait, etc. So many of the candidates are having difficulty to study the theory because of the duty timings. They are not able to attend the online live classes or offline classes. And many of them, what they do is that they by heart the materials which they get from the social media and they directly go for the exams. As a result, they are not able to score the proper required score for their exams. For all these problems, we have found a solution, which is EJV's online app. So mostly the pattern of the question is that there will be a scenario, and below that there will be 4 options, and we have to select the correct answer. So most of them, because of the lack of theory knowledge, they are not able to select the correct answer. Okay, so we are providing a solution for that. In the question discussion section, we not only provide the right answer, we explain about the condition and the rationale of the right answer. Okay, so we have uploaded classes in addition to these question discussions in our app. So it is easily understanding, so that it helps to clear the exams properly and you will score high marks. If you study the materials and the question discussion properly according to our instructions, we assure that you will get the required marks and you will pass easily. Okay, coming to the features of our online app program, it is a 35 hours online class in which there is HD video classes which we have already recorded and uploaded in our app. And second, we also have PDF materials in which there are questions which have come recently for our exams. Okay, and third thing is we have mock test, so that you can practice questions and you can check that how far you have improved your knowledge. And fourth, we have exam mode test, in which you can practice the questions just like how you prepare for your exam or how you attend in the exam center. Okay, so all this helps you to gain knowledge and also to score high marks. Okay, there are some additional features which we provide. First thing is that you will have individual faculty assistance. Whenever you have doubt, you can clear the doubts with your faculty who are available in online, or you can call them and you can clear your doubts. The most important feature of our app is that convenience. You can watch the theory classes according to your time. There is no time frame inside our app, so the duty problem will not be an issue. Whenever you are free, you can watch, and you can watch any number of time you want. Okay, then recently asked questions. We have a WhatsApp group in which we discuss with the students or candidates continuously. We make sure that they are covering the topics properly, and we also provide them recently asked questions given by the previous attended candidates. Okay, and we are daily updating the questions inside our app, so please watch it. If you like this video, like, share and subscribe. Please share it to your friends so that they also get benefit from our app. So these are the facilities we provide. Thank you. Okay. Hi. So next question is, a nurse was trying to establish a therapeutic communication with the patient who is having schizophrenia. During the conversation, she noticed that he says, "I go, shop, hop, bop, top." Which of the following symptom reflects the patient's speech pattern? Option A, neologism. Option B, flight of idea. C, clang association. And D, pressure of speech. So let's see what is the statement of the patient, which is, "I go, shop, hop, bop, top." So there are 4 options. Option A, neologism. In neologism, patient creates new words which are meaningless. Okay, some sound it will be, but it will not have any meaning. And in flight of ideas, which is a common feature in schizophrenia and mania as well, in flight of ideas, patient constantly jumps from one topic to another. There will be a connection between 2 topics, but the patient jumps from one topic to another, which is known as flight of ideas. And in pressure of speech, just like it is mentioned, the patient will stress on the words, will apply much pressure on each words, which is known as pressure of speech. And option C is clang association, in which the patient uses several words, but all these words will sound similar. If you see the option, the statement here, patient says, I go shop, hop, bop and top. There are 4 different words, but all these words sound similar. The end will comes with op, which pronounced as op. So shop, hop, bop and top. So all these words sound similar, and so the answer is clan association, in which patient uses several words, but all those words sounds similar. So option C, clan association is the right answer. Next question, a nurse in the newborn nursery is assessing a 2-hour-old baby, 2-hour-old newborn. She observed that the newborn has a caput succedaneum. Which intervention has the highest nursing priority? So we should know about what is caput succedaneum. Caput succedaneum is a swelling on the head of the baby due to the extra pressure from the uterine wall on the baby's head during prolonged or difficult delivery. So during prolonged or difficult delivery, baby's head will be stuck in the pelvic cavity, and due to the extra pressure on the fetal head, it results in a swelling on the head of the baby, which is called as caput succedaneum. So risk factors, as I mentioned, is prolonged or difficult delivery, and second important risk factor is vacuum extraction, which is a method we used for delivery of a baby who is having difficult delivery. So because of the pressure of the vacuum on the fetal head, it will result in caput succedaneum. So in this picture you can see the swelling, this area, this is the swelling, which is known as caput succedaneum. And the points about caput succedaneum is that it requires no treatment. It will resolve normally within 3 to 4 days. So this is an important feature, swelling of the head of the baby due to the pressure from the uterine wall because of prolonged or difficult delivery. Risk factors, prolonged or difficult delivery or vacuum extraction. So coming to the question, a nurse in the newborn nursery is assessing a 2-hour-old newborn. She observed that the newborn has caput succedaneum. Which intervention has the highest nursing priority? A. Activate code blue immediately. B. Turning on the radiant warmer. C. Do nothing, it will resolve in 3 to 4 days. D. Administer oxygen by nasal cannula. So just like we discussed, caput succedaneum requires no treatment. It will resolve within 3 to 4 days. So if you see the option C, which is do nothing, it will resolve in 3 to 4 days. So option C is the right answer. Next question, a female patient will do the breast implant surgery and she tells the nurse not to tell her family about the surgery. What is the nature of this action? So this is a question which comes under nursing administration. Here the patient is undergoing breast implant surgery. Before surgery, the patient asks the nurse that patient is requesting the nurse not to tell her details of her condition to any other members of her family. So what is the nature of this action? So here the patient wants her condition to be kept as a secret. So maintaining the client details as a secret is known as which action? That is the question. Let's see the options. Option A, confidentiality. B, ethical dilemma. C, illegal nursing practice. And D, medico-legal practice. So there is no legal issues in that. So illegal nursing practice and medico-legal practice can be avoided. Ethical dilemma means confusion. What to do and what not to do is dilemma. And confidentiality, option A, confidentiality means maintaining the client details as a secret or not sharing personal information to anybody else. So here the nursing action or the ethical principle used is confidentiality. Confidentiality means maintaining client details as a secret or not sharing personal information to any other people. Next question, what are the 3 stages of separation anxiety in order? So separation anxiety, this is a very important question. Separation anxiety means the extreme anxiety shown by a child when the parents are separated or when the parents go away. So this is known as separation anxiety. The question is, what are the 3 stages of separation anxiety in order? So there are 3 stages of separation. Before that, we will go to the option A, protest, despair and detachment; B, despair, protest and detachment; C, detachment, protest, despair; D, protest, detachment and despair. So the 3 stages of separation anxiety is that the first stage is protest. Protest means not allowing the parents to go away. Okay, so that is the first stage, protest. And then in the second stage, when they realize that parents are going away, they will become desperate and they will start excessive crying. So second stage of separation anxiety is despair. And the third stage, once they are gone away, the child will sit alone until the parents come back. They will not talk to anybody else until they come back, which is known as detachment. So the 3 stages of separation anxiety in order is protest, in which the child will not allow the parents to go away, and second, despair. When they go away, they will become desperate and start excessive crying, and after that, when they realize they are gone, the child will be detached from everybody else and will sit alone until their parents come back. So protest, despair and detachment are the 3 stages of separation anxiety in this order. Next question. A female patient saw the IV tubing as a snake. The nurse considered this reaction as. So here a female patient thinks that IV tubing is a snake. Nurse consider this reaction as option A, illusion; B, delusion; C, hallucination and D, panic attack. So panic attack means the patient will have intense fear during stressful situation. Whenever there is stressful situation, patients become extremely tensed. So at that time, patient will show symptoms like breathing difficulty, shortness of breath, choking sensation, excessive sweating, and even the patient will have fear of dying. So that condition is known as panic attack. In hallucination is a false sensory perception without any external stimuli. There won't be anything, but the patient sense that there is something. So that is known as hallucination. Delusion means a false unshakable belief. Patient will stick on to the wrong belief which he has, and he or she will not fluctuate from that. So a false unshakable belief is known as delusion. Illusion. In illusion, the patient thinks one object as another, just like we see in magic. Patient will see one object as another. So here the patient saw IV tubing as a snake. So seeing one object as another is known as illusion. So option A is the right answer. Next question is position during liver biopsy. This is also important. Position during liver biopsy. Option A, prone position; B, supine with right hand below the head; C, right side lying; and D, left lateral. So during liver biopsy, we should access the liver easily. So in order to access the liver easily, or in order for the easy access of liver, you should place the client on the left lateral position, so that the area where liver lies is on the right upper quadrant. So it will be easy for doing any procedures like biopsy. So the position during liver biopsy is left lateral position. There is another position used, which is supine with right hand above the head, not below the head, above the head, so that the costal area will move up and it will be easy for doing biopsy. So here the option is supine with right hand below the head. So the answer is wrong, and the most used position is left lateral position. So option D is the right answer. So there will be another question like, what is the position after liver biopsy? So during liver biopsy, the position used is left lateral for easy access of the site, but after liver biopsy, you should turn the patient towards the right side. So after biopsy, position used is right side lying with a pillow or sandbag underneath to prevent bleeding and pain associated with the procedure. So position during liver biopsy, left lateral; position after liver biopsy, right side lying.